Hey everyone. So if you're getting ready for the NCLEX, you know the feeling, right? It's like an absolute avalanche of resources, and you have no idea where to even start. Well, today we are going to cut through all of that noise. We're going to build a clear, focused map to get you to the finish line.
Does this sound a little too familiar? I bet it does, because you are definitely not alone. I mean, this quote from a student on Reddit just hits the nail on the head. It perfectly captures that anxiety so many of us feel. The goal isn't to use every single resource out there, it's to use the right ones for you, and that is exactly what we're going to figure out right now. So, here's our game plan. We'll start by talking about that resource overload and how to deal with it. Then, we'll get into the official blueprint, super important. After that, we'll cover the power of practice questions, how to master the content you're weak on, why you need a support system, and finally, how to put this all together into a real actionable plan.
Okay, first things first, let's just address the elephant in the room. There's this concept called the paradox of choice. It basically means when you have way too many options, you kind of freeze up. It leads to this decision paralysis. So instead of helping, that endless list of prep tools can actually make it harder to just get started and stick with a plan.
So where do we begin? Easy. We go straight to the source. The single most important first step you can take is to get familiar with the materials from the people who actually make the exam, the National Council of State Boards of Nursing, the NCSBN. The thing to understand is that the NCLEX isn't just a test of what you can memorize, it's about how you apply that knowledge. This clinical judgment model is literally their framework for testing that exact skill. Understanding this is like being handed the rule book before you play the biggest game of your life.
And you can find all those rules in 3 key documents, and they're all free on the NCSBN website. The test plan tells you what content is on the exam, right down to the percentages. The bulletin explains how the test actually works, logistically, and the tutorial shows you the format of the questions. Seriously, read these first.
Okay, now let's get to the most critical part of your prep. Once you know the rules of the game, it's time to actually start playing. And for the NCLEX, that means practice questions, a lot of them.
And here's why they work. Doing questions does so much more than just test what you know. They force your brain to actively recall information, which is way more effective for memory than just passively reading a textbook. They build up your mental stamina for a long, tough exam. And they help you start to recognize patterns and how questions are worded and how to spot those tricky distractors.
So, which question bank or Q bank is the one to use? Well, here are some of the most popular and well-respected options out there. The key thing to remember is there is no single best one for everybody. So many of these offer free practice tests. I would highly recommend you try a couple out. See which one feels right to you before you commit your money.
Now, most Q banks have different modes, and you need to use them strategically. Tutor mode is absolutely fantastic for learning the material because you get that instant feedback and the rationale right away. But timed exam mode is crucial for simulating the pressure of the real thing and for tracking your speed and performance. A really solid study plan will use both.
As you're grinding through those practice questions, you're going to find your weak spots. It's inevitable. Maybe it's pharmacological and parenteral therapies, things like calculating IV flow rates or remembering all the high alert meds. That's not a failure. That's just data. It tells you exactly what you need to go back and review, which is where videos and study guides come in.
Believe it or not, YouTube is an incredible free resource if you know where to look. Each of these channels has a totally different vibe. If you need a really deep, comprehensive lecture, check out Registered Nurse RN. If you learn best with goofy memory tricks and visuals, Simple Nursing is amazing. For quick, to-the-point facts, Level Up RN is perfect. And of course, Mark Clemek's audio lectures are legendary for teaching you how to think, not just what to know.
And sometimes you just need a quick guide you can print out to pull a topic together, right? These sites offer awesome free cheat sheets and study guides. They're perfect for reviewing key info without sitting through a whole lecture. They are great to have on hand while you're doing your practice questions.
Okay, so we've covered the what and the how of studying, but there's another piece that's just as important, the who. Look, preparing for the NCLEX is a marathon, not a sprint, and you absolutely should not run it alone. Connecting with other people who really get what you're going through, it's a huge psychological boost. These online communities are active literally 24/7. They're places where you can ask that silly question you're afraid to ask anyone else. You can read success stories when you need motivation. You can vent your frustrations, and you can find strategies that have worked for thousands of other students who have been in your exact shoes. All right, we've gathered all the pieces of the puzzle. We have the blueprint, the Q banks, the content review, the community support. Now it's time to put it all together and build a concrete plan that turns that feeling of being overwhelmed into a feeling of being in control.
So what are you going to do tomorrow? Here it is, your plan for week 1. Just look at how simple and manageable this is. The goal is not to do everything at once, it's to build momentum. Start right here. Download that official test plan, take a diagnostic test, and 1 Q bank, and then just commit to doing and reviewing 75 questions a day. That's it.
And this really brings us to the most important point of all. Success is not about owning 10 different review books and having 5 QBank subscriptions. It's about picking 1 or 2 high-quality resources in each category and then just using them consistently. Find what works for you and build your plan around that.
Because at the end of the day, the plan and the resources, they're just tools. You are the one who's going to earn that license. They give you the structure, but you provide the effort, the grit, and the critical thinking. So my question to you is, what is the very first concrete step you are going to take right now today to get started on this journey?